Ghana is expected to receive 300,000 Russian-made Sputnik V vaccines this week to get our vaccination program back on track. The country has struggled to keep to its plan following supply cuts from India. Now, the Asian country is the main producer of AstraZeneca vaccines, but it is struggling on its own to cope with demand at home and to deal with significant surge in COVID-19 cases. Speaking to journalists on the sidelines of an event to mark the 11th Africa Vaccination Week in Ghana, Health Minister Kweku Agyeman-Manu said he expects delivery of some 300,000 doses of the Sputnik V vaccines this week.
We are trying to make efforts to try to get in the country some Russian-type Sputnik. Though we have made initial approaches and expecting some shipments to come in. They demonstrated availability and brought in the first 160,000, which is kept there, waiting for about 300,000 to come sometime this week. We were expecting about 2-3 weeks back, but we have faced challenges with vaccine availability and payment structures and things like that. I believe sometime this week we may receive the 300,000.
Health Minister Kweku Agyeman-Manu. Now, even though more countries are turning to the Russian-produced Sputnik V vaccine, a latest report by Brazilian health authorities questions its efficacy. Head of laboratory at the FDA, Eric Kakari-Boateng, says the revelation on the Sputnik V vaccine has not provided sufficient grounds to doubt the efficacy of the vaccine. He says the FDA is prepared to take the necessary action on the administration of the vaccine if need be. He spoke earlier in an interview on Joy News Today.
They did not mention the site where it's coming from. And that's an information not very, but then the one, we don't give, when we are giving emergency use authorization, it is site specific. You cannot bring it from any other site than the one that was approved for you to bring to
Okay.
Ghana here. The sites that were approved are coming from Russia, about 2 sites in Russia. So we know the sites where the products are supposed to come from. The protocols is that is, ANVISA is a regulatory authority like us. We would look out for more information, specifically the parties that are involved and where it's coming from. That's something that will be done.
In this case, now that you have new information, would the professional advice be that we hold on until we are able to independently verify the claims by Brazil, until we start administering Sputnik V?
Could I hear your question? What type of new information are you talking about?
The one from Brazil, that this could contain...
And did you see any specificity in what the Brazilians said?
But we just spoke to an immunologist who shared with us that those concerns must be looked at.
Yes, of course, it must be looked at. I heard you are very well. Yes, and what the points that he's raising are very valid. But that's what I'm saying. The Brazilian statement, did they tell you that the live virus, was it found in component 1 or component 2?
Sir, that's why I'm coming to you, because you are head of the laboratories at the FDA, and so you are the one who should tell us.
The component 1, the vaccine comes in 2 components. There's component 1, that is the adenovirus vector 26, and then the component 2, adenovirus vector 5. If you have to wait for us to get the certificate of loss release, we compare it to the clinical bacteria from the coupon. If there need be that we have to do the needful, we will do it. If we have to, if the virus it will be done.
And is it of concern to the FDA that this is not approved by the World Health Organization and the European Medical Agency?
Yes, why should it be a concern to us?
Right. So, Dr. Aboagye, we're about to receive some of these vaccines, several 100,000 of them. But from the very beginning, it was clear that the WHO was yet to approve this vaccine. Should this not be a cause for concern for us?
Thank you. So I think our FDA actually approved the AstraZeneca and the Sputnik V from Russia. And they might have obviously received a dossier or something from these companies and have actually scrutinized and advised us that these are the ones that we have to use. I think as a country, we do have the right to opt for which of the vaccines we want. So I think it's exactly the process that the FDA have actually gone through. Our FDA is obviously one of the best in terms of recognition across the world. I think they are in category 3 or something. So the fact is we do have a choice. There is nothing stopping us from getting the vaccine from Russia. It's a choice that we have made, and it's something that we are following, and we are getting the vaccine. We are trying so hard to get the vaccines in so that we'll be able to vaccinate our population. The FDA is in charge of safety, and they are our key advisors in terms of safety. They've told us that's safe based on the document reviewed, and we will go by that.
Right. Dr. Abuaje, I mean, the FDA itself, in the clip that we just played, admit that they have not looked into these latest concerns coming out of Brazil, even though virologists here in Ghana, like Dr. Yaw Bediako, are saying that we ought to look into them. So however good you are, if you haven't looked into something, then you can't really advise on it. So at the moment, do you not feel that we perhaps should be impressing upon the FDA to look into it so they can give us comfort that we're still okay with Sputnik V?
Okay, so thank you. I think the predominant variant in our country is the Brazilian one. Is the UK one. That's the. Let me put it again. Let me say it again so that you get me. The predominant variant in our country is the UK strain, right? And obviously, when the vaccines are received as well, the FDA do test. Obviously, they get samples and test. I think that was what the FDA man was trying to put across, that until we get the vaccines in to test, because so when it comes, it's under FDA, until they release it to the Ghana Health Service, unlike all the other vaccines. So I think that was the point he was trying to put across, that when the vaccines are received, it will be validated again by the FDA before it is released to the Ghana Health Service. Even though we'll keep it in our cold room and everything, they will be working with us to make sure that it is safe. I think that was the point he was trying to emphasize.
We are due to receive some nearly expired vaccines from Congo, according to reports. Will there have to be some special handling of them due to their status, or are they good to go? What's going to be the process with them?
Okay, so thank you. I think what we have done is that we have trained our staff to deploy. Obviously, to be able to assist us to use the vaccines quickly once they are in, once we have the approval from FDA because of the short expiry date. We've done it before. When we had the South African the MTN donation, it has shorter expiry date. But because of our strong immunization program, expanded immunization program, we were able to obviously use these vaccines within that short period of time. So it is exactly what we're going to do. I think it is also coming through from COVAX. And COVAX did an assessment and they got the information, or after reviewing our document, they knew that we are able to obviously use these vaccines quickly, immediately receive them. That is why we have been considered under this plan as well. We are capable. We have the necessary manpower and the necessary logistics to obviously deploy once we receive them quickly.
Dr. Dacosta Abuaje, in charge of risk communication at the Ghana Health Service, thank you very much for your time with us. We appreciate the clarifications. Right, let's take a breather. We won't be long. More after these.